Hi, I'm Lisa Costa-Bir and we're here at the 8th Annual NIIM Symposium 2023 Melbourne. I'm joined here by Dr. Cris Beer. Welcome to FX Medicine, Cris.
Thank you. Thanks very much.
Now, you're an integrative GP and you presented today. Can you tell us a little bit about your presentation?
So I presented on the pharmacogenomics of integrative mental health care, so how we can use genetic information to best guide patient management, and I think it's something that will be increasingly utilised in the future. So it was an introduction to that today.
Fantastic. Now, can you tell us a little bit more about your presentation for our audience at home that didn't get to see?
I guess pharmacogenomics is it's a bit of a buzzword at the moment, genetic information, how we can use that in clinical practice. It's come into its own in the last 18 months because we now have a complete human genome. We've been able to map that. We know what that looks like. There's something called the 100,000 Genome Project, which means 100,000 people have donated their genetic material to be looked into to see if there are any differences between people that have diseases and people that don't, people that respond to medications, people that don't. So it's kind of that concept, and how can we use that in integrative mental health care, not just to predict response to medications, but also nutraceuticals, which has not been looked at, and I think it needs to, because they're bioactive substances. We know that. They work, we know that, but they don't work for everyone, or they may not respond in the way that we think that they will. So we need that information, I think. I think it'll just be another tool in the clinician's toolbox going forward, and we'll see, watch this space. I think in the next 5 years, the clinical information we have will be very different to what we have today.
Amazing. Now, have you used this in your practice? Yeah. Could you give us a little bit of an insight into maybe something you've done with a client and seen?
Yeah, I guess there's two applications for it. One application is de novo. If someone wants to know, what am I genetically predisposed to, or what medications are going to work for me? I've had a history of, say, depression or anxiety, and if I need nutraceuticals or I need medication in the future, what's going to work? I don't want to do this trial and error thing that I've done before. So there's that side of it. The other side is people that are having side effects or not responding, and they want to know, well, what can I try? I've tried everything. I don't want to do this merry-go-round anymore. I want to feel better. You can then apply that genetic testing, that information to the scenario to hopefully guide patient management so that you can improve outcomes, really. It's about patient safety and outcomes at the end of the day.
Amazing. Really, really interesting. So you've been at the presentation all weekend. Has there been another presentation that's really resonated with you?
Yeah, I mean, they've all been amazing. And the impact of COVID-19 is really highlighted in a lot of the presentations, I think, across the weekend. And, I think it's a changing landscape clinically. We're seeing a lot sicker patients for a lot longer, unexpected presentation. There are numbers that we are seeing that we've never seen before. So I think that we need to be talking about it a lot more from a longer-term sequelae and not just, oh, well, COVID's over, let's move on. No, people are still struggling. I think that's important to keep that dialogue going in this space, the integrative medicine space.
Absolutely. Now, you've written 2 books. Tell us about those, and where can our audience also connect with you?
Yeah, they're just consumer-based books. They're easy to understand. They give a taster into, what we do as integrative health practitioners and how to incorporate some of those principles in your life. Healthy habits was one, and healthy liver is another. Website's probably the best point of call. Yeah, drcris.com.au. Yeah.
Fantastic. Thanks so much for joining us, Cris. Thanks everyone for joining us. Don't forget to check out our socials and visit us on our website for lots of clinical resources, including our articles, infographics and podcasts. I'm Lisa Costa-Bir. We'll see you next time.